Ever get that, like, nagging ache in your hand? You know, maybe after a long typing session or spending time in the garden, just those everyday things.
Oh yeah, definitely. I think a lot of people experience that.
Right. And you've reached out because you're trying to make sense of it. You sent over some really interesting information.
It is fascinating stuff.
So we're going to focus in on the metacarpophalangeal joints for this deep dive.
The MCP joints for short. Yeah, basically we're talking about the knuckles,
Yep.
right where your fingers meet your hand.
Exactly, those knuckles. And it might seem like a small area to focus on, but
You know, it's amazing how crucial they are. The material you shared really emphasizes that these joints are like the foundation of so much of what our hands can do.
you're absolutely right. I mean, think about it. Gripping a pen, buttoning a shirt, even just scrolling on your phone.
All those things we take for granted.
Totally. All of that relies on healthy, mobile MCP joints. So our mission here is to, well, unpack all this great information you've sent over. We're going to look at what causes pain in these joints, what the symptoms are, how it's diagnosed, and what the treatment options look like.
And hopefully make it all clear and easy to understand.
Precisely. So first things first, we need to define what we're actually talking about. What are MCP joints?
Well, as the information you sent explains, the MCP joints are technically those knuckle joints, the ones that connect the metacarpal bones in your hand to the first bones in each of your fingers.
Those long bones in the hand are the metacarpals, and the first bones in your fingers, the ones closest to your palm, are called the proximal phalanges.
Yeah, exactly. So they're like the hinge points for your fingers.
Makes sense. And they're not just simple hinges, right?
No, not at all. These are actually classified as condyloid joints.
Condyloid, I'm not familiar with that term.
It basically means they have this kind of ball and socket structure. Not as deep as like your hip or shoulder, but still, that shape gives them a really remarkable range of motion.
Oh, I see. So it's not just bending and straightening.
Nope, you can move your fingers side to side too, towards each other, away from each other. You know, that's how we can do things like turn a key or play an instrument.
It's amazing when you think about all the tiny movements our hands can make.
It really is. And the material you shared really highlights those key functions. So obviously gripping and pinching are huge. Those are essential for just about everything.
Right, like holding a cup or picking up small objects.
Exactly. But they also give your hands stability, that overall structure. And then, of course, there are the fine motor skills.
Like writing, typing, playing piano, so many things.
Precisely. And given how much these joints do and how mobile they are, well, it's not surprising that they can sometimes become painful.
That makes sense. And from the information you shared, it seems there are quite a few potential causes for that pain.
Yeah, there are. We're talking about things like arthritis, injuries, infections, gout, even problems with the ligaments or tendons surrounding the joint. It's quite a broad range.
It is. Okay, so let's break this down a little. Yeah. Starting with arthritis, that's a word we hear a lot when we talk about joint pain.
And the information you provided mentions several types of arthritis. The first one is rheumatoid arthritis.
RA for short.
Right, RA.
Yeah.
And this one's an autoimmune condition.
Meaning the body is essentially attacking itself.
Yeah, essentially. So in RA, the immune system attacks the lining of the joints, which causes inflammation and damage over time.
I see. And your material also talks about something called ulnar drift.
Oh, right. That's important to mention. So ulnar drift is this thing that could happen, especially with long-term RA inflammation. It's when your fingers start to shift sideways towards your pinky finger.
That sounds pretty noticeable.
It can be. And it can also affect how your hand functions. So if you're experiencing any kind of shifting in your fingers, that's definitely something to bring up with your doctor.
Got it. So with RA, we're talking about the immune system attacking the joints. What about osteoarthritis? Is that the same idea?
Not exactly. Osteoarthritis is more about wear and tear. So over time, the cartilage, that's the cushioning between your bones, starts to break down. It kind of wears away.
So it's more of a gradual process of the joint wearing down.
Exactly. And that's why it's often called wear and tear arthritis.
Okay, that makes sense. Now there's another type mentioned in your information, psoriatic arthritis. What's that one?
So psoriatic arthritis is linked to psoriasis.
Psoriasis, that's the skin condition, right?
Yep, the one that causes those red, scaly patches on the skin.
Yeah.
Not everyone with psoriasis gets psoriatic arthritis, but it's a known association.
Okay, good to know. So we've covered the main types of arthritis. Let's move on to the second category, trauma or injury.
That one seems pretty straightforward, but it's still good to be specific.
Right. So what are we talking about here?
Well, we're talking about things like fractures, dislocations, that's when the bones move out of place, and sprains. Sprains are injuries to the ligaments that hold the joint together.
Ouch. That sounds painful.
It can be. And, something that might resonate with your experience is what they call repetitive strain injuries. So you don't necessarily need a single big event to injure these joints.
Interesting.
Yeah. It could be those repeated motions, like typing for hours on end or certain movements in sports, that put stress on the joints over time and eventually lead to problems.
That definitely rings a bell. I know I felt that twinge in my hand after a long day at the keyboard.
Right. And that's why ergonomics are so important. It's all about positioning and using your body in a way that minimizes that stress on the joints.
Great point. All right, next up we have infections.
Infections in the joints are definitely something to be aware of.
What kind of infections are we talking about specifically?
The information mentions septic arthritis. That's when bacteria or a virus gets into the joint.
How does that happen?
It can happen in a few ways. Sometimes it's through a direct injury, like a cut near the joint. Other times it can spread from an infection somewhere else in the body.
So it's not always obvious where it comes from.
Right. But what is clear is that septic arthritis is very painful and needs prompt medical attention. It's not something you want to wait and see about.
Absolutely.
No?
Okay, next on the list is gout. I've always associated gout with the big toe, but it can affect other joints too, right?
Oh, absolutely. Gout can definitely affect the hand.
So remind me, what causes gout?
It's buildup of uric acid crystals in the joint. Uric acid is a normal waste product in your blood, but if you have too much of it, these crystals can form.
And those crystals cause the pain.
Exactly. They trigger a really intense inflammatory response, and that's what causes the pain and swelling.
Okay, that makes sense. So while the big toe is a common spot for gout, it's definitely not the only place it can show up.
Right. And the information you sent over is helpful for understanding that broader perspective on gout. It can pop up in various joints.
Good to know. And finally, we have problems with the ligaments or tendons.
Right, those are important too. So ligaments are the tough bands of tissue that connect bones together.
And tendons connect muscles to bones.
Exactly. And problems with these structures around the MCP joints can definitely cause pain.
So what kind of problems are we talking about?
Well, with ligaments, it's often sprains, which means they've been stretched or torn. And with tendons, it's usually tendinitis, which is inflammation of the tendon.
So a lot of potential culprits for MCP joint pain. Now, how does someone know if they're actually experiencing this? What are the typical symptoms?
Well, pain is the most obvious one, right?
Of course. But does it present in a specific way?
It can. It might be pain that specifically happens when you grip or pinch something. Or in more serious cases, it might be this constant dull ache, even when your hand is at rest.
That constant ache sounds like it would really interfere with daily life.
Oh yeah, it definitely can. And then there's stiffness. Like you might have trouble moving your fingers first thing in the morning or after you've been sitting still for a while.
That's common for a lot of joint problems, that morning stiffness.
Yeah, exactly. You might also see swelling around your knuckles.
So the visual signs of inflammation.
And you might find it harder to fully bend or straighten your fingers. We call that limited range of motion.
So that's when the pain and stiffness start limiting how much you can move the joint.
Right. And another thing to look out for is weakness in the hand. Like you might find it harder to hold things or do the things you normally do with your hands.
That could be really frustrating.
Absolutely. And going back to rheumatoid arthritis, ulnar drift can also be a symptom. Remember how we talked about the fingers shifting towards the pinky?
Right. So lots of potential symptoms to watch out for. Now, if someone is experiencing some of these symptoms, what's the process for figuring out what's going on? How is this diagnosed?
The key is to get a proper diagnosis. Because, like we talked about, there are so many possible causes for MCP joint pain, and the best treatment will depend on what's causing it in your specific case.
That makes sense. So how do they figure that out?
Usually the first step is a physical exam. So the doctor will look at your joints, feel for any tenderness or swelling. They'll also check your range of motion, how well you can move your fingers.
So that's the hands-on evaluation.
Right, but sometimes they need more information, so they might order imaging tests. X-rays are great for seeing things like fractures or dislocations. They can also show signs of damage, like if the space between your bones is narrowing, which can happen with osteoarthritis.
X-rays, those are the go-to for bone problems.
Yeah, exactly. But if they want to see the soft tissues, like the ligaments and tendons, they might order an MRI.
MRI, that's the one with the big magnet, right?
Yep, that's the one. And sometimes they use ultrasound. That can help them see inflammation or fluid in the joint.
So a variety of ways to get a visual on what's happening inside the joint.
Exactly. But it's not always just about the joint itself. Sometimes they'll also order blood tests.
Blood tests, why would they do that?
Well, blood tests can show if you have inflammation in your body, which can point to things like rheumatoid arthritis. They can also check for certain antibodies that are associated with autoimmune diseases.
I see. So it's about looking for those markers in your blood that can give clues about the underlying cause.
Precisely. And in some cases, they might even take a sample of fluid from the joint. We call that a joint fluid analysis.
What does that tell them?
It can help them identify things like an infection, or if there are uric acid crystals present, which would suggest gout.
So it's like getting a closer look at what's going on inside the joint.
Exactly. And all of this helps them put together a clear picture of what's causing your pain.
Okay, so once they figured out the cause, what are the treatment options for MCP joint pain?
Well, the treatment really depends on what's causing the pain and how severe it is. But the information you shared does a good job of outlining the different approaches. They basically break it down into non-surgical and surgical options.
Let's start with the non-surgical options. Those are usually the first line of treatment, right?
Exactly. They try to manage the pain and address the underlying cause without surgery.
What are some examples of those non-surgical treatments?
One of the big ones is medication. So you might have heard of NSAIDs. Those are non-steroidal anti-inflammatory drugs.
Like ibuprofen or naproxen.
Yep, exactly. Those can be really helpful for reducing both pain and inflammation.
So that's like tackling two birds with one stone.
Yeah, exactly. But sometimes you need something stronger. So for severe inflammation, they might give you a corticosteroid injection.
Corticosteroids, those are powerful anti-inflammatories, right?
Exactly. They inject them directly into the joint to really target the inflammation.
Got it. What about for autoimmune conditions like RA? Are there specific medications for those?
Yeah, there are. They use DMARDs, which stands for disease-modifying antihematic drugs.
DMARDs, so those actually help slow down the progression of the disease.
Right. They work by suppressing the immune system, which helps to reduce the inflammation and damage to the joints.
Okay, so medications are a big part of it. What else is there?
Physical therapy is often very helpful.
Physical therapy, so exercises and stretches.
Exactly. A physical therapist can teach you specific exercises to strengthen the muscles around the joint, improve your flexibility, and increase your range of motion.
So it's all about getting those joints moving better and making those supporting muscles stronger.
Precisely. And they might also give you a splint or a brace to wear.
A splinter brace, what's the purpose of that?
Well, it helps to support the joint and take some of the stress off of it. It can also help to restrict movement, which can be helpful for healing.
So it's like giving the joint a little extra support while it recovers.
Exactly. Now, apart from the professional treatments, there are some things you can do yourself to help manage the pain.
Lifestyle changes and things like that.
Right. One of the simplest but most important things is to rest your hand. Just avoid activities that make the pain worse.
That makes sense. Give it a break.
Yeah. And if your pain is related to repetitive motions, think about ergonomics. So that might mean adjusting your workstation, using different tools, or taking more breaks.
So basically finding ways to do those things without putting as much strain on your joints.
Exactly. And then there are the classic hot and cold therapies.
Oh, right. The good old ice pack or heating pad.
Exactly. So you can apply heat to help relax the muscles around the joint. And ice can help reduce swelling and inflammation.
Simple but often effective. Now, at what point would they consider surgery for MCP joint pain?
Well, surgery is usually reserved for when non-surgical treatments haven't worked, or if there's significant damage to the joint that can't be addressed with other methods.
So it's kind of like a last resort.
In most cases, yes.
What are some of the surgical options they might consider?
One of the procedures mentioned in the information you shared is called a synovectomy.
Synovectomy, what's that?
It's a procedure where they surgically remove the inflamed synovial tissue. That's the lining of the joint.
So it's like taking out the inflamed part.
Right. They often do this for conditions like rheumatoid arthritis where there's persistent inflammation.
Got it. What are some other options?
Another one is joint fusion.
Joint fusion? What does that involve?
Basically, they fuse the bones of the joint together. So they become one solid bone.
That sounds pretty drastic.
It is, but it can be really effective for pain relief. Because once the bones are fused, you can't move the joint anymore.
So no more pain because there's no more movement.
Exactly. But obviously that also means you lose the function of that joint.
Right, so it's a trade-off.
It is. And then the last option is joint replacement surgery.
That's where they put in an artificial joint.
Exactly. So they take out the damaged joint and replace it with a prosthetic one made of metal and plastic.
That's a pretty major surgery.
It is. But it can be a really good option for people with severe arthritis who have a lot of pain and have lost a lot of function in their hand.
Okay, so that's a good overview of the surgical options. Now, I know you've mainly been talking about MCP joint pain specifically, but the information you shared also touches on pain in the fingers and metacarpals more broadly.
Right. It's important to remember that all the things we've talked about, like arthritis, injuries, infections, and gout, they can also affect other joints in your fingers and hand.
So the same culprits can be at play.
Exactly. And those same symptoms we talk about, pain, stiffness, swelling, limited motion, weakness, those can all apply to other finger joints as well.
Got it. What about those immediate steps someone should take if they suddenly develop pain in their metacarpal area? What's the first line of defense?
Well, the usual advice is to rest the hand, use over-the-counter pain relievers like NSAIDs to help manage the pain and inflammation, and you could try applying ice or heat to see if that helps.
So those are the tried and true methods for acute pain.
Exactly. But it's crucial to see a doctor if the pain doesn't go away or if it gets worse.
Yeah, you don't want to just ignore it and hope it goes away on its own.
Right. You need to get a proper diagnosis to make sure you're treating the underlying problem.
The information also mentions some ways to reduce MCP joint pain in the long term. Can you talk a little about those?
Sure. It basically boils down to staying consistent with your treatment plan. So that means taking any medications as prescribed, doing your exercises regularly, and using those splints or braces if your doctor has recommended them.
So it's about being proactive and sticking with the plan.
Exactly. And, there's no one-size-fits-all answer to the question of what's the best medicine for finger joint pain.
Because it really depends on the cause, right?
Precisely. NSAIDs are good for general pain and inflammation. Corticosteroids are better for more severe inflammation. And then you have the DMARDs for autoimmune conditions. It all depends on what you're dealing with.
And how long does it typically take for these things to heal?
Well, that really varies. For minor injuries, it might just be a few weeks. But for chronic conditions like arthritis, it's often about ongoing management rather than a cure. And if you have surgery, it can take several months to fully recover.
So it's important to be patient and realistic about the healing process.
Definitely. Now, we've been talking about MCP joint pain in general, but the information you shared also mentions pain in specific fingers.
Right, like the ring finger, the index finger, the middle finger. Are there any specific things to note about those?
Well, the basic causes are usually the same, but the way we use our hands can make certain fingers more prone to problems. For example, the index and middle fingers are often involved in gripping, so they might be more susceptible to strain.
Interesting. And what about if someone notices an MCP joint lump? That could be a bit alarming.
Yeah, any new lump should be checked out by a doctor.
Ah.
But in the context of MCP joints, it could be a few things. It could be a ganglion cyst, which is a fluid-filled sac that's usually harmless. It could be a rheumatoid nodule, which is associated with rheumatoid arthritis. Or it could even be a bone spur, which can form with osteoarthritis.
So a lump could be a sign of a few different things, and it's best to get it checked out just in case.
Exactly. And what about swelling in the joint or pain when you press on it?
Do those point to any specific issues?
Well, swelling, as we've discussed, is a sign of inflammation, which could be from arthritis, infection, or injury. Pain when you press on the joint could suggest a fracture, tendinitis, or localized arthritis.
So those are all important clues for the doctor.
Right. And when they're trying to diagnose the cause of your pain, they'll consider a few main possibilities. It's called a differential diagnosis.
Differential diagnosis, what does that mean exactly?
It basically means they're looking at a few different conditions that could be causing your symptoms. So for MCP joint pain, the information you shared highlights rheumatoid arthritis, osteoarthritis, gout, and infections as the main things they'll consider.
So it's about ruling things out and narrowing down the possibilities.
Exactly. And when it comes to the thumb, they'll also consider things like de Quervain's tenosynovitis. That's a condition that affects the tendons on the thumb side of your wrist.
Okay, so a lot of factors to take into account. To wrap things up, what would you say is the key takeaway from all this information we've discussed about MCP joint pain?
I think the biggest takeaway is that MCP joint pain is a complex issue with lots of potential causes. But by understanding those causes and the various symptoms, you're in a much better position to manage your pain and seek the right treatment.
And the information you provided really underscores the importance of early diagnosis and treatment.
Absolutely. Getting that early diagnosis and starting the appropriate treatment can make a huge difference in preventing complications down the road.
Totally. And I think it's great that you've taken the time to research this and gather this information. As you reflect on everything we've discussed, think about which of the causes or symptoms seem to fit your situation.
Yeah, that's a great point.
And, those non-surgical approaches we talked about, rest, ergonomics, hot and cold therapy, those can be really helpful for managing pain in your daily life. But ultimately, talking to a doctor is always the best way to get a personalized diagnosis and treatment plan.
Couldn't agree more.
And if this deep dive has sparked more questions for you, maybe you want to learn more about a specific type of arthritis or explore those surgical options in more detail. There are tons of resources out there to help you dig deeper. But the good news is, with the right approach, it is possible to get those MCP joints feeling better and get back to doing the things you love.
That's a great note to end on.
Indeed.
Thanks for having me. This was great.
My pleasure. It's been a fascinating deep dive.
Absolutely. And to everyone listening, take care of those hands. They're pretty amazing tools.
Couldn't agree more.